The secret to living a longer, healthier life isn't locked away in some exclusive lab, but it's actually within reach, right here, right now. So forget what you think you know about getting older. We're not talking about a slow, inevitable decline. We're talking about a future where vibrant health and vitality extends far beyond what we ever thought possible. This is the promise of longevity medicine, a revolution in healthcare that is no longer science fiction, but a possibility demanding a place. And it starts with the most fundamental medicine: primary care. I'm Dr. Hilary Lynn, and I'm a primary care physician who's obsessed with the future of healthcare. I trained at Stanford and Columbia, and over the years, I've seen it all, from the halls of academia to the front lines of digital health, from free clinics to the VA, and even within Taiwan's universal healthcare system. I've also built companies and platforms across the digital health landscape, tackling everything from mental health to oncology and neuroscience. But my true passion now lies in longevity medicine, specifically these questions around it. Is longevity medicine all just biohackers and hype? How can we take the incredible advancements in longevity science and use them to transform people's lives today? And importantly, how do we shift from a reactive sick care system to one that's proactive, preventive, and laser focused on extending not just lifespan, but health span? So in a few moments, we're going to unpack how we can fix our broken primary care system to be that ideal version of healthcare that I guarantee every person wants for themselves. We're going to talk about how to democratize advanced medicine by making longevity focused care a reality. And importantly, we'll explore how AI can be a game changer in this transformation, creating a future where your annual checkup is less about putting out fires and more about optimizing your health for a longer, more vibrant life. I'm also going to dive into the real world benefits of this new model for patients, clinicians, and owners alike. My day-to-day work is focused on elevating primary care practices to bring this vision to life, and I'm excited to share some insights we've learned along the way. So let's get started. So we've talked about this exciting vision of the future, a future where primary care is synonymous with longevity medicine. But to understand why this shift is so crucial, we need to take a hard look at where we are today. Let's be honest, for most people, the words primary care don't exactly conjure up images of cutting-edge medicine. Instead, we think of rush appointments, long wait times, and a focus on treating whatever ailment happens to be bothering us right now. This is the system that burnt me out and burnt out so many of my colleagues. It's a system that's designed to be reactive, not proactive. We go to the doctor only when we're sick to get a prescription and hope for the best. Rinse and repeat. So this model has incentivized sick care, not health care. And that's not what primary care should be. True primary care in its ideal form should be the cornerstone of a preventive health-focused approach. Primary care doctors are supposed to be the quarterback of a person's health care. We're supposed to understand each person's unique biology, lifestyle, environment, and risk factors, and we're meant to work together to create a personalized roadmap to optimal health. Not just for the next day or week like an urgent care clinic, but for the next decade and beyond. So think about it. We meticulously maintain our cars with regular checkups and preventive maintenance to avoid breakdowns. We need to apply that same logic to our own bodies. They are, after all, the most complex and valuable machines we'll ever own. And yet, the annual physical has declined to something of a joke. We barely covered the loosest screening protocols to make sure a person's life isn't at critical risk of death in the next year or two. And anything that doesn't have a 10% or higher chance of killing a person this decade is punted to a future date. But kicking the can down the road allows the underlying illness to develop. It dooms us to a future where we will become sick. And sadly, this is the absolute norm in healthcare systems, not just in the US, but around the world. So this is where health span focused care can make a difference. This is about shifting the focus from treating the disease to actively promoting and extending healthy lifespan, the truest form of preventive care. It's about identifying and addressing the root causes of aging, which is the reason for many diseases to manifest. And we're talking about leveraging advanced diagnostics like comprehensive biomarker testing, genetic and genomic risk assessments, and in-depth lifestyle analysis to gain this deeper understanding of a person's health. We also need to empower people with personalized strategies, everything from tailored nutrition to exercise regimens and stress management techniques. And yes, we've been talking about diet and exercise for decades, but not like this. Now we have access to science-backed, sophisticated strategies to get us from a mere pass to an A in each of these fundamental foundational pillars of health. So this is where primary care should be, a proactive, personalized, and preventive approach that empowers people to live longer, healthier, and more fulfilling lives. And importantly, this model is not a pipe dream, it's an achievable reality. So by embracing the principles of longevity medicine and leveraging the power of AI transformation, sneak peek, we can elevate primary care into the cornerstone of a truly preventive healthcare system. So we've covered the why we need to convert primary care to true longevity preventive care. Now let's get into the how. What does a longevity-focused practice actually look like in action? And importantly, how does it differ from a traditional model? And what are the tangible benefits for everyone, from patients to doctors to health leaders? Today's clinics are sterile monoliths. In some of the clinics I've worked in, we didn't even have windows. This is because experience and design has fallen by the wayside in a world where we're churning through patients like wildfire. The reasons are based in a fee-for-service world where volume generates more reimbursement dollars from insurance companies. This soulless incentive system prioritizes care for illness over prevention. Less than 3% of healthcare dollars today are dedicated to preventive care. Now imagine walking into a primary care practice that feels less like a sterile box and more like a personalized wellness hub. This is a transformed primary care practice, a place where cutting-edge science meets compassionate care. So let's go through the areas that we need to improve in order to practice true Healthspan-focused medicine. First, we need to go beyond the basic checkup. Instead of a cursory once-over, a person needs to undergo a comprehensive health assessment, such as advanced biomarker testing, not just a CBC, a CMP, and a basic cholesterol panel. We're talking about in-depth analyses of inflammation markers like HSCRP, hormonal profiles that go far beyond TSH to give us full thyroid and sex hormone function, and a detailed metabolic panel to include things like fasting insulin and, of course, HbA1c to assess insulin sensitivity, and also things that many doctors haven't even heard about, like lipoprotein(a), to provide a more complete picture of cardiovascular risk. So these tests provide a window into one's body's internal workings, revealing hidden imbalances and potential risks far before they manifest as illness. For example, an elevated high sensitivity CRP is associated with increased risk for cardiovascular disease, neurodegenerative disease, and even certain cancers. Next, I want to talk about genomics. Understanding your genetic predispositions is incredibly empowering. For example, knowing if you carry an ApoE4 gene variant, which is linked to increased risk of Alzheimer's disease, can motivate proactive lifestyle changes and targeted interventions to mitigate that risk. And of course, we want to talk about lifestyle and environmental factors. This is where the rubber meets the road. We're talking about a detailed assessment of one's diet, exercise habits, sleep patterns, stress levels, and even exposure to environmental toxins. Wearables come into play here too, offering us insights on things like continuous glucose levels or heart rate variability for stress and recovery. Did you know that chronic stress can accelerate cellular aging, and poor sleep quality is linked to increased risk of many diseases such as obesity, diabetes, and heart disease? And of course, pulling this all together for a personalized health plan. This is where the magic happens. Based on a comprehensive assessment, a longevity and health span focused practice would deliver a personalized health plan that's as unique as every human. Tailored recommendations, no more generic advice. We're not talking about just getting 3 workout sessions a week. We're talking about specific actionable recommendations tailored to one's individual needs and goals. So personalized nutrition plans designed to optimize metabolic health, exercise regimens that fit lifestyle and fitness levels, and proven stress management techniques that can help one build resilience, but it can also adjust according to all this continuous metric data collection that we get through wearables. And this would include details from some of the advanced testing we described. For example, most people do not absorb much cholesterol from their diets, but a third of the population actually absorbs over 60%, requiring specific diet changes. Next, we talk about evidence-based supplementation. Where appropriate, targeted supplementation can play a role in optimizing health and addressing specific deficiencies. For example, if your biomarker testing reveals low vitamin D levels, which are linked to a host of health issues, your plan might include a recommendation for vitamin D supplementation. There would be attention to detail too, not just any formulation or dose of vitamin D, but the right one treatment for you. Also, remembering additional supporting supplements like vitamin K and magnesium, an important cofactor for vitamin D to be activated and metabolized. Next, of course, we need early intervention strategies. So this is about proactively addressing potential health risks before they become full-blown problems. If your assessment reveals pre-diabetic markers, for example, your plan might include specific dietary and lifestyle interventions, a continuous glucose monitor, and another wearable like an Apple Watch to help you reverse course and prevent the development of type 2 diabetes. Even adding on medications early as needed, from metformin to GLP-1 agonists such as semaglutide, which is Ozempic and Wegovy, or tirzepatide, which is Mounjaro and Zepbound. And we have to stay vigilant with proactive monitoring and follow-up. So this isn't a set it and forget it approach. Longevity medicine is about ongoing support and adjustments to your health plan. Of course, you're going to want to have regular check-ins with your doctor to monitor progress, address any challenges, and fine-tune the plan as needed. And if you're a doctor, make sure that this isn't just a regular appointment where you're like, do you have any problems? Let's address the problems. We're talking about proactively addressing even the slightest uptick in a negative biomarker, for example. Every single visit is an opportunity to build a strong relationship between patient and doctor. And as I keep talking about, we need to have technology-enabled support designed and integrated throughout this entire process. Remote patient monitoring through wearable devices that track activity levels, sleep quality, and other vital signs is imperative. For example, if your wearable device detects an irregular heart rhythm, your doctor can be alerted and we can do additional workup, such as with a Zio patch or some other more clinical grade wearable product that can determine if you have something dangerous going on. And in this new model, the role of the clinician evolves. We as doctors and other medical professionals become less of a gatekeeper to more of longevity specialists and this true health coach and partner in a patient's longevity journey. In this model, we're equipped with knowledge and tools to guide patients every step of the way, and we can provide support, motivation, and accountability. This will lead to this more meaningful patient relationship and greater professional satisfaction. I've definitely noticed I am so much happier practicing this way than in that revolving door model of primary care that too many of us have to work in. So this is a win-win-win situation. Regular, everyday people, patients will have improved health outcomes, much more energy and vitality, and a greater sense of control over your health destiny. So imagine feeling your best, not just right now, but for decades to come. And for doctors and other clinicians, it's a much more fulfilling and impactful way to practice medicine with a focus on prevention and the space to build deeper relationships with our patients. Even if you're not a clinician, if you are an investor or a practice owner or an innovator, a thriving practice built on the foundation of patient loyalty and improved outcomes and a sustainable business model is the reward. This is the future of primary care, a future where everybody benefits. Now, this might seem like a challenging lift for the average primary care practice. After all, it's already hard work trying to keep up with a panel of 1,000 patients. So let's now talk about how we can turn this ideal version of preventive care to reality. There's not only clinical transformation that needs to take place, as we just discussed, there's actually two other major areas of transformation to evolve today's medical model towards longevity-focused care. We've painted this picture of an ideal future of primary care, proactive, personalized, and longevity-focused. But how do we get there? How do we scale this model to make it accessible for everyone, not just the privileged few? The answer in large part lies in embracing a powerful and controversial ally, artificial intelligence. So this is an area of hot debate in medicine and the public right now. We're truly living in a remarkable moment in history. The convergence of breakthroughs in longevity science and the rapid advancements in AI is creating an unprecedented opportunity to revolutionize healthcare. Last year, the Nobel Prize in Chemistry didn't go to chemists. It went to AI scientists for creating AlphaFold, an AI that can predict protein folding and thus transform everything from understanding disease causes to rapidly discovering new drugs to cure such diseases. This isn't just some distant sci-fi future. This is about what's possible right now. But let's address the elephant in the room. Many people, including many doctors, are understandably wary of AI. There are fears that it will replace doctors and reduce the human element in medicine or even churn out unreliable information. A 2024 KFF poll found that 63% of the public are not confident that AI chatbots provide accurate health information. That's really understandable because we see hallucinations all the time. However, those fears, while absolutely valid, don't tell the whole story. Today, 17% of adults use AI chatbots for health information. These tools are still new, and like with any other new technology, trust is earned over time. So that percentage will undoubtedly grow, and people will grow much more comfortable with using AI day to day for their health and wellness problems. And just as society has adapted to include Dr. Google as a first-line medical assistant, we now have Dr. AI, which will soon be the front line for essentially the entire population. So this is scary sounding to a lot of people, but the truth is AI has the potential to be an extraordinary partner in delivering longevity-focused, healthspan-focused preventive care. It's not about replacing the doctor, it's about augmenting our capabilities, freeing up our time, and providing us with the powerful tools to deliver better, more personalized care. I use AI regularly in my own clinic, and it truly has helped me become a better doctor. Think of AI as a tireless, incredibly intelligent assistant, one that can sift through mountains of data, identify patterns that humans might miss, and provide data-driven insights to inform clinical decision-making. That Kiev poll revealed that the public is unsure about whether AI mostly helps or hurts in finding accurate health information. The numbers show us that it is our job as clinicians to build that bridge of understanding and trust by showing the concrete ways that AI can improve the care we deliver. Really, as doctors and clinicians, we can serve as a translator of the raw information that AI is spitting out. So here's how AI can be a game changer in a longevity-focused primary care practice. First, supercharging diagnostics and risk prediction. So AI algorithms can analyze medical images like X-rays, MRIs, CT scans with incredible speed and accuracy, detecting subtle anomalies that might be missed by the human eye. This is actually showing up in a lot of new tech. I just talked to a couple of different companies that are using retinal images to tell you whether you have early signs of heart disease. Not only that, but AI can also analyze massive amounts of patient data. So things like medical history, genomics, biomarkers, and lifestyle to identify early signs of high risk for age-related disease years before we develop the earliest symptoms or signs that we can detect on regular blood tests, for example. So one controversial idea is that we will someday, very soon, need fewer specialists as a result of AI. Specialists meaning like endocrinologists, nephrologists, neurologists, and so forth. So right now, I know all the primary care doctors out there, like myself, are a bit frustrated that in today's business models in healthcare, you need to specialize to make any real money. This is the way that billing codes work and the way that the health system has optimized revenue generation. But I would argue that in a world with AI, we will need many more generalist doctors who can use AI than esoteric specialists who understand just one disease or a tiny part of the body. AI will be a better specialist than any human ever can be. So if you're a medical student today, take note. The second big area is in personalizing treatment and intervention. Like I was talking about earlier, AI can help doctors tailor treatment plans based on a person's unique characteristics and goals. It can provide personalized recommendations for nutrition, exercise, and other lifestyle modifications, taking into account genomics preferences and even your socioeconomic context. Say goodbye to those standardized after visit summaries. You know, those like dot phrases where you can generate like person came in with a headache, and then it generates like all the things you could do for a headache, but it's super standardized and it doesn't take into account your specific causes and your specific context. So now we're moving into a world where every person can finally get an individualized health plan. And this is what we'll all need if we want to live 100 healthy years. The next big area is in enhancing remote patient monitoring and telehealth. This is all the stuff that happens on the computer and the phone. AI-powered wearable devices and remote patient monitoring devices can track vital signs, activity levels, sleep patterns, and other health data in real time. So this continuous stream of data allows for proactive interventions and can help prevent hospitalizations by identifying potential problems early on. So for example, an AI algorithm might detect subtle changes in a patient's gait that could indicate an increased risk of falls, prompting the doctor to intervene with preventive measures. And more practically for everyday, relatively healthy wearables users, we can now detect sleep apnea and atrial fibrillation with an Apple Watch. We can detect sleep changes with a smart mattress and even air quality changes with connected AQI devices. These technologies, while generating countless new data, will also enable us to understand better the impact and efficacy of different interventions so that we can switch and adapt plans midway if needed. Now I want to talk about a not so sexy topic, which is boosting operational efficiency and practice management. That is a huge mouthful. Essentially, all the boring parts of healthcare, like administrative tasks, scheduling appointments, processing insurance claims, managing patient records, and billing, can be done by AI. By doing so, AI will free up doctors to spend more time doing what we do best, which is talking to, educating, and caring for patients. This not only improves efficiency, which will mean lower healthcare costs, but it also reduces burnout and increases job satisfaction, which I know many people out there are probably not doctors, but it is incredibly important for sustaining a healthy healthcare system. In my own clinic, I use tools that can help me create these sophisticated, highly customized plans with detailed instructions for the patient without spending too much extra time. And within the next year, we'll not just be spending a little extra time, we'll actually be saving massive amounts of time with AI first tools. The trick is to make big moves rather than incremental ones. We need to adopt entirely new software platforms that are designed with AI first technologies. Adapting old software actually makes this transformation much harder and more expensive. And then finally, I want to talk about how AI can help doctors in making better, more data-informed decisions. Because at the end of the day, AI is an assistant, albeit a genius one, to all people, including doctors. As we mentioned, most people right now aren't confident that they can distinguish the true from false info in AI responses. And this is where the doctor AI partnership becomes critical. So the clinician develops a trusted relationship with the patient that can help discern the signal from the noise. And at the same time, clinicians need to understand how AI works so that we can actually tell what's real and what's not, because even doctors can be tricked by hallucinations. Until the day AI can perfectly mimic human empathy, we, as doctors and patients alike, can work together towards very individual, very human health goals. This AI healthcare revolution is not about replacing human judgment or empathy. It's about enhancing it. And it's about giving burnt out doctors, like all my friends out there, the tools that we need to provide the best possible care in a very complex and rapidly evolving healthcare landscape. And excitingly to me, by embracing AI as a partner, we can actually unlock the full potential of longevity medicine and make it accessible to everyone much more quickly. It's only with dramatic technology advancements that we can finally overcome the barriers that all of this data and complexity creates so that we can get to optimizing health and extending health span for everyone. You might be thinking, if this vision is so compelling, why hasn't it already happened? Why are we still stuck in a system that is sick care rather than healthcare? So the answer in large part is in the way we pay for healthcare. Traditional payment models have unfortunately created a system that incentivizes volume over value, hindering the adoption of truly preventive approaches. Remember, I said less than 3% of healthcare dollars goes towards preventive medicine in the United States. But I believe this is changing. The entire landscape of healthcare delivery is in flux, and we have new models emerging that will challenge the traditional way of doing things. Understanding these models, and particularly their business and payment implications, is crucial for everyone, whether you're a doctor, a business leader, a health innovator, or a patient. So let's take a look at some of the key trends shaping the delivery of care today, with a particular focus on how they're paid for. First, we have the rise of something called concierge medicine. So concierge practices offer a more personalized and accessible approach to primary care, typically for an annual membership fee. Patients enjoy longer appointment times, greater access to their doctor, and a focus on preventive care. The business model is the key differentiator. This is often a direct pay membership model outside of traditional insurance networks. This allows doctors to have smaller patient panels, seeing perhaps only 100 or 200 patients at a time rather than thousands, which unfortunately is the case for a lot of primary care doctors. And as a result, you get more time with each visit, and this fosters a proactive preventive approach. And because concierge practices are often early adopters of new technologies and preventive approaches, they're a natural fit for longevity-focused care. However, the higher cost, with a minimum of $1,000 a year and a maximum that is, as far as your imagination goes, I've seen prices upwards of $250,000 a year, can really limit accessibility and highlights the need for more inclusive models. Speaking of which, we have the telemedicine revolution. The delivery of healthcare services remotely via video conferencing, phone calls, and other digital platforms is now becoming more and more routine. So telemedicine experienced this explosive growth during the pandemic and is now a mainstay of modern healthcare. I myself converted my own practice completely over to telemedicine for a number of reasons, including how it can cut costs for patients and can improve care. So let's talk about the business model. Telemedicine can be integrated into traditional practices, offered as a standalone service, or incorporated into employer-sponsored health plans. So payment models will vary, including the traditional fee-for-service or the more concierge-like subscription-based, and can be a hybrid of all of which, including insurance reimbursement. Importantly, many insurance companies will reimburse for telemedicine visits, making it a lot more accessible. This is important for longevity-focused care because right now, not a lot of doctors practice it. So we need a way to scale longevity medicine, particularly for people who live in remote areas or who have mobility limitations. It also enables all of those technologies around remote patient monitoring and facilitates more frequent check-ins. So imagine just jumping onto a Zoom call rather than having to trek your way to a clinic somewhere 20 minutes away. This makes longevity-focused medicine a lot more accessible to everyone. So the trouble I've seen with telemedicine-only models has less to do with the fact that they're telemedicine, and actually more to do with the fact that because there's less defensibility and competitive moats, because a patient can switch from one to another telemedical platform quite easily, many telemedicine models compete by racing to the bottom with price as well as quality. So it doesn't mean that it's impossible to have quality telemedicine care. Like I mentioned, I love and practice telemedicine myself. It just means that we have to be acutely aware of this danger as innovators. Then, of course, we have a hybrid model. So we can combine in-person and virtual care, offering people flexibility to choose the mode of care that best suits their needs at the time. I like this way of practicing, and in an ideal world, I would do so for my own practice as well. There are just considerations of cost, of course, specifically where you are based. Where I'm based in Manhattan, New York City, it is extremely costly to have an in-person clinic and therefore limits the ability to scale and to reach a lot of the population. However, if you have an in-person clinic, you can offer testing on site for everything from blood tests to things like DIXA scans and VO2 max testing. Whereas most patients actually prefer to have the consultation itself, such as talking to your doctor to create a new health plan, over telemedicine. The payment model can be, again, a mix of insurance reimbursement, fee-for-service, and membership options, or even value-based care contracts with insurers, including employer-sponsored health plans. This flexibility of a hybrid model is super important and key to attracting and retaining patients in today's market. And it offers a powerful platform for delivering longevity-focused care, combining the benefits, like I mentioned, of that in-person aspect where you can do assessments in person, but then continue relationship building over convenient telemedicine. Now, I want to also touch on a couple of non-clinical models that are incorporating more medical services. This is really quite exciting and out of the box, although, as you'll see, it almost feels like a natural evolution of the existing models. First, we have the emergence of wellness clubs and gyms with integrated health services. If you're familiar with certain luxury gyms like Equinox or Lifetime, these establishments are now expanding beyond traditional fitness offerings. They already offer things like supplements and personal training and nutrition counseling, and are starting to add on biomarker testing and even primary care like consultations. These high-end gyms are offering longevity-focused programs, recognizing that a lot of folks who go to these high-end gyms are interested in optimizing both performance and health span. The business model here is membership-based. I haven't seen an insurance-covered model yet for this wellness club gym model, and often there's a tiered pricing for different levels of service. So everything from a few $1,000s a year to I've seen upwards of $50,000 a year has been offered in the market. This creates a recurring revenue stream and fosters a strong sense of community around health and wellness. It also taps into the growing consumer demand for holistic wellness and preventive health, and it meets the client where they are. You can imagine if you're somebody who already goes to the gym, you're much more likely to be reaching for those health span, longevity type interventions. I think it's a really interesting approach. Next, we have the transformation of med spas. Medical spas are clinics, albeit slimmed down ones, where they offer certain more cosmetic, typically, services, such as Botox or fillers and similar type of services. Many of these are actually incorporating more and more medical services. Typically, I see the first thing is GLP-1 agonist. So they'll add on weight loss transformation services, but we're also seeing more and more longevity type services as well. lifestyle. With regards to the business model, it can be similar to the gym model, like a membership model, or in a lot of cases, because med spas typically already operate on a fee-for-service basis, they continue that for the longevity services. And there's typically more of a focus on elective procedures and treatments. I think it's really fascinating because you can incorporate a lot of these wellness and health span focused interventions like hormone optimization therapies, IV drips, like I mentioned, weight management services that can enhance a person's health span. I think the danger is a lot of med spas are not run by clinicians. They're typically run by completely non-medical leadership, and there might be a nurse that is doing the day-to-day procedures, but I think if you are going to a med spa, just be careful where you choose to go and make sure that the leadership team is actually a clinical medical one. But what do all of these models have in common? They're experimenting with new payment models that move away from the limitations of traditional fee-for-service covered by health insurance plans. There are these direct pay memberships, subscription services, or value-based contracts that create financial incentives for more proactive preventive approaches. And for people who are owners and leaders of health organizations, I think it's so imperative to understand these evolving models. Seriously consider a membership option or a subscription service, or trying to even get a value-based contract that rewards proactive care and long-term health outcomes. Leverage technology, integrate telemedicine, remote patient monitoring, and AI-first tools to enhance care delivery, improve efficiency, and personalize the patient experience. And of course, focus on that patient experience. We want to make healthcare a place that is enjoyable. We don't want it to be like, oh man, I have to go to my doctor once a year and it's a terrible experience. And then finally, I think that is so important to have strategic collaborations amongst doctors, with wellness centers, with technology companies and innovators, and even employers to expand services and reach new markets. This collaborative approach is essential for creating a holistic ecosystem of longevity-focused care. So we've seen how new care delivery models, innovative payment structures, and the power of AI are converging to create this perfect storm for a revolution in primary care, a revolution that puts longevity medicine at the forefront. However, this transformation is not going to happen on its own. It requires every person to take action. So, what can you do starting today to be part of this exciting movement? For clinicians and practice owners, this is your chance to be a pioneer in the future of medicine. Some concrete steps you can take today are to start learning, dive into the world of longevity medicine. There's tons of resources available: online courses, conferences, webinars, scientific journals. Start with a topic that interests you, like the role of inflammation in aging or the science of personalized nutrition. Even 15 minutes a day of focused learning, perhaps by subscribing to a legitimate newsletter, can make a lot of difference. I use AI tools, of course, like Open Evidence, to superpower my learning with actual scientific evidence. Next, rethink your practice model. Could a membership-based model or a hybrid approach work for your practice? So start by exploring different payment and care delivery models that could allow you to offer more proactive, preventive care. Talk to colleagues who have made the switch, or work with a consultant, a professional who has converted a similar practice's payment models to this new hybrid approach. And experiment with technology. You don't need to overhaul your entire practice overnight. Start small, try a new AI-powered diagnostic tool, explore a remote patient monitoring platform, or even just start with a more detailed intake form that captures lifestyle factors. And I think an area any doctor can and should explore is that of consumer wearables. Understanding how Apple Health works, for example, is an easy gateway to integrating more technology. And very importantly, become a champion for change. Talk to your colleagues and your patients about longevity medicine. Share your knowledge and enthusiasm. You can be a catalyst for change within your community. The most important and difficult area of change in healthcare is cultural change. So I've been a health tech founder for the last 7 years, and I've raised VC dollars for my tech first ventures. I deeply believe that the innovator community is integral in making a true impact in the longevity revolution. So if you are an innovator or an investor, here are some starting places to join in the revolution. If you are an engineer or designer, develop user-friendly AI-first solutions. Focus on creating AI tools that are intuitive, accessible, and seamlessly integrate into real clinical workflows. You have to work with clinicians to understand the needs and pain points, and prioritize making these tools useful for independent practices, not just for large institutions, which often don't care about the user experience for doctors, and they're actually just trying to bump up their revenue. Next, also, you should prioritize interoperability. Break down the data silos and design systems that can talk to each other, sharing data securely and efficiently. This is supremely difficult, but essential for creating a holistic view of patient health. Whether you're a patient or a doctor, you probably know what I'm talking about. We've got data coming in from our watches, our phones, our computers, and of course, our EMR at different medical centers. It's so hard to understand what's going on when it's all over the place. Even I myself, I'm a doctor and an innovator, and I still find it hard sometimes because we get our information in all these PDFs, and you have to pull it all together into one consolidated dashboard to get that holistic view. And of course, focus on ethical considerations like data privacy, security, and algorithmic bias from the ground up. We are entering a world where cybersecurity is going to be a major issue due to more and more nefarious parties using advanced, also AI-powered technologies to break through security systems. Emphasize cybersecurity and build trust with your users by being transparent about how your technology works and how it's being used. And if you're an investor, like an individual angel investor or part of a PE or VC firm, seek out and support companies and initiatives committed to democratizing longevity medicine. And whether or not you belong to one of the above groups, you are a patient, and you are the most important part of this equation. Not only is your health your most valuable asset, but you actually can make the greatest impact on this longevity evolution. First, become an active participant in your health. Ask your doctor about longevity medicine. Do your own research online. Use open evidence, that tool that I mentioned, and also read studies on PubMed. So learn about the key lifestyle factors that influence healthy aging, like nutrition, exercise, sleep, stress management, as well as interventions on the mitochondria or senescence or on apoptosis. Pick one area to focus on and make a small change today. Demand more from your healthcare providers and advocate for yourself. Don't be afraid to ask your doctor about advanced diagnostics, personalized health plans, and a more proactive approach to your care. You deserve a doctor who's a partner in your quest for optimal health. If your current doctor isn't on board, search for someone who is. So many people spend so much time researching what the best air fryer is, or maybe what the best car is, and then they make their decision based on hundreds of hours of research. Unfortunately, very few people take that level of intensity to choosing their doctor, and I would argue your doctor is probably more important than what air fryer you're using. Embrace technology as well. Use all of those wearables that I mentioned and get familiar with health apps and other technologies that can help you track your own progress and gain insight into your health. If you are somebody who doesn't like technology at all, start with something really simple, like a step tracker. This is a pivotal moment. So we all have this chance to transform healthcare from a system that treats sickness to one that optimizes health. But it's going to take all of us working together to make this vision a reality. My work is focused on building these very partnerships and collaborations, connecting visionary clinicians with cutting-edge technology innovators, and empowering patients to take control of their health. We're building a movement to democratize advanced medicine and make longevity-focused care accessible to everyone. Because we believe that everyone deserves the opportunity to live a longer, healthier, and more fulfilling life.